Hi, this is Dr. Andrew Goldsmith with another Quick Bites for Dentistry. I want to talk to you about adult sealants. Now, many times we don't recommend treatment because insurance doesn't cover it. But yet we still perform the treatments in some capacity or another. So an example of that is when we do sealants on kids' teeth. A lot of times we do it, we recommend it, and it just gets done because it's covered by the insurance. But we don't recommend sealants on adult teeth. Why? Look, I leave it up to the patient. I tell them, I go, look, we normally do sealants on kids' teeth when they're young and they're erupted, and insurance covers it. So if I were to do a sealant on one of your teeth, insurance is not going to cover it. But here's what I can do is I can go in there and do what I call a preventive resin restoration. I can go in there and just open up the grooves a little bit. What I do is I use a fissurotomy burr, one of those tiny pointy burrs, and I just trace through the grooves real delicately. Or I use air abrasion and air abrade right into the grooves. Clean out the grooves, get out all the stain, and then what I do is I take the time to place a sealant properly. And I actually etch and bond sealant into place. And I typically even use a flowable resin, not just a sealant material. That way I know that they're getting a quality restoration that truly is preventive. And if it's up to the patient or whether or not they do it, at least I've recommended what I believe is something that will be preventive for them down the road. They may have to pay for it out of pocket, but the reality is I know that if I do it properly, it will truly prevent them from getting decay down the road. So I'm going to recommend that you give this a try. One of the things that I know is that, let's look at the numbers for a minute, just purely from a business perspective. If you go out there and start performing adult sealants, and you did just one a week, and let's say you did it for 50 weeks out of the year. I don't know what you charge for sealants in your office, but multiply out the numbers. I'm sure that it's a significant enough number that you can figure out what to do with that. Whether it's hire an additional person at your office, whether it's provide additional services, it might be going to a CE event, or it might be buying a nice gift for your wife. I'm not sure what you would do with that, but it's a great service. It elevates your standard of care. It does a great thing for your patients. It's something small that can make a big difference in your practice. If you want more tips or ideas on how to elevate your practice, go to process23.com. We have systems in place there where you can download video training series. We have a series called 23 Ways to Build an Ideal Dental Practice. In that, there's 23 different components. You can pull out what works best for your practice, all for the cost of less than what it would be to have a practice consultant to come into your practice for even just 1 month. And as part of that whole system, we also have downloadable resources like PDFs and worksheets and spreadsheets that you can use to help you monitor your practice as well. It's an awesome deal and an awesome program. I encourage you to go take a look at it. In the meantime, go out there, elevate your standard of care, and make today a masterpiece